Okay, I think we're ready to start now, Dr.
Okay. Well, I think some of the most important work, clinical pathologic correlative work, was done by people like Craig Tishers and others who work on the fine structure of the tubules in different renal functional status. And I still believe that ultrastructural study can yield some important information.
It seems to me, for renal pathologists in general, the glomerulus has always been far more glamorous than the tubulointerstitial or the vascular compartment, and it really is only in the last decade that they have come into their full sense of worth,
Yeah.
as people like Craig have studied them. Let me ask you, Dr. Pirani, before we close, just a few more questions about looking back on your career and the body of work that you have accomplished. I would be curious to know, in your own estimation, what you consider to be your most valuable contribution to the field overall, or if there are several that you would want to name.
Well, it's difficult for me to choose. Perhaps I'm partial myself. I think my work with Bob Clark and Victor Pollack and Robert Murky on lupus nephritis probably stands out. However, there are other studies which I think are important in my estimation. For example, a study we did with Michael Koss, who is now professor of pathology at the University of Southern California, on experimental myeloma kidney, in which we tested several light chain proteins and find out that only one of the 3 light chain protein tested was able to reproduce the disease. I think that was an important contribution that eventually may lead, hopefully, to more specific therapy of multiple myeloma. In other words, depending on the type of light chain protein, toxicity to the kidney may vary considerably. And that's an important study in my mind. I mentioned others, for example, the work of Stejskal on discontinuity of basement membrane is still a work which has not been fully evaluating its functional significance, really, and but still may lead to more significant changes, significant results. So there are several papers, and but I cannot say I'm more attached to one than to another, really.
Is there one that you think has made a bigger impact on the nephrology community?
The lupus made a big impact. I think the work with John Louis on post-rep nephritis and Louis Salinas, who is now professor at the University of St. Louis University in St. Louis, I think that was an important piece of work because, primarily because of the series of observation on sequential biopsy and the study of the resolution, the rapidity of resolution of the disease. So I think that's important. It may explain a number of clinical features of post-streptococcal nephritis.
Now, you've received a number of major awards in your career. I'm thinking of the John Peters Award in particular in 1987, and this past year an award from the Renal Pathology Society. Which one, or are there others that have been a particular source of pride to you?
Well, certainly the John Peters Award is the major award I was lucky to receive. Being awarded by a society which is primarily made up of clinicians. So after all, the work of pathologist has to get recognition by clinician at a certain moment. If it is felt the work is useful to the patient, has some importance in therapy and so forth and so on. But I'm very attached to a smaller award that I received way back in 1955. in which the second year class in the medical school at the University of Illinois awarded me the Best Teacher of the Year award. He gave me a small golden apple. And I was really moved by that. And after all, for a teacher, there is nothing that can beat the recognition by students as a teacher. And believe me, it's much more difficult to get recognition from students than it is from your peers. So that's really is something that is still very close to my heart.
As you look back, Dr. Pirani, is there anything that you would do differently if you had a chance to relive your life? Are there any regrets you have in terms of the twists and turns your career have taken?
Well, it's impossible to answer that. The only thing that my life probably demonstrates is that life is an adventure. You cannot really predict what is going to happen to you, or what you can guide your destiny only to a very limited extent. I certainly could not have predicted that I'll leave Milano, that I've come to the United States, that I'll become a professor first at the University of Illinois and then at Columbia. And certainly I could not have predicted what came out of renal biopsy either. So much of my life was dictated by chance, and I was lucky overall, I think, to be able to work with very good men over the years who left an imprint on my way of thinking, I guess, and guided some of my activities.
Well, I can certainly re-echo that sentiment personally, because I think there's been no more fortuitous event in my own career than having had the opportunity to work with you, as I did in 1980
I
and
was
again
lucky to
in
have you as first as a research fellow, and then as an assistant, and then as a successor. So thank you very much for your help.
Well, thank you very much for the opportunity to interview you today, Dr. Pirani. It's been a pleasure as always. Although I've heard many of these stories before, they always improve on the re-embellishing that you give them second and third time round. It's been a pleasure for me. Thank you.
Thank you. That's it.
Okay. So what we can do is maybe